Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about what medical billing and coding or health information management position is right for you. We're going to be discussing some of the job titles, okay, in today's episode. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. Because I have seen and saw and done a lot in this field, I created my channel with the hope of sharing all of this with all of you. So if you want more of that content, I hope you'll hit that subscribe button, like, and share this. All right, let's begin. Okay, so you are going into the health information management field or the medical billing and coding field, okay? What kinds of positions are there? It's not just about being a medical biller or being a medical coder. There's also leads. There's also data quality folks. There's clinical documentation improvement practitioners. There's supervisors. There's HIM directors. There's lots and lots of different things that you can do in this field. So let's go ahead and get started. And I will say this. A lot of people say, I want to do medical billing and coding. Oftentimes, a medical biller and a medical coder is going to be two separate people. Sometimes it is the same person. It depends on the size of the facility, or maybe it's a doctor's office, and sometimes it is just one person doing it. So it really does depend on where you are. But for the most part, it's like this. Medical billers are dealing with the insurance companies and the patients, okay? That is what they do. That is primarily what they do. Sometimes they have communication with the provider. It depends, again, how big the place is, okay? Now, the medical coders are often communicating also with the billers. If there's an issue, sometimes the billers will get something back from the insurance company. They'll have to kick it back to the coder, okay? So the medical coder is going to be dealing with the provider and looking at the documentation. And that is the extent of who we are with, okay? Because we don't deal with, medical coders don't deal with the patients, okay? We deal with the providers. We're making sure that everything that the provider is doing is coming out clear in their documentation so that we can select the codes appropriately for coding purposes, okay? So that is what we do. And having really good communication skills does help, because when you deal with these alpha personalities like these providers, communication is key, all right? Now, in some places, the coders don't talk to the providers, which I think is a personal travesty. However, there are different rules for different places. And sometimes in a facility, they will have one person, like a clinical documentation improvement specialist, that is doing all of the communicating with the providers. Now, what is a clinical documentation improvement specialist? That is a person who is looking at documentation and can see where there's deficiencies. They can see where the holes are and where the provider can be a little bit more clear, or the provider can say a little bit more about what they're doing here, because what they're saying is either incomplete or it needs to have more detail, like if they are repairing laceration sutures. If they're repairing lacerations, are they going through different layers? And oftentimes, coders can do this, but when you have somebody who's been specially trained as a clinical documentation improvement specialist, the American Health Information Management Association has a special credential called the Clinical Documentation Improvement Practitioner, the CDIP. Now, this person is going to be looking at documentation and looking for those holes and looking to make the quality of the documentation a lot more better, and working one-on-one with these providers to make sure that they understand and that they are educated. Because while some providers will select their own diagnoses, it is on the coders to make sure that those diagnoses are correct. And if they're not, then the coder has to go through and select the correct diagnoses, and procedures, whatever is reflected in the documentation. Now, auditors are really close with clinical documentation improvement, right? Although clinical documentation improvement is working with the providers, auditors are working more with the coders. They're doing, just like their name says, they're auditing. They're making sure that the coders are selecting the appropriate diagnoses and the appropriate procedures. Now, I get emails all the time from people who are in school and they're very excited and they tell me, Blue, I really want to be an auditor. Okay. So here's the thing with wanting to be an auditor. It is a very good position to have. Okay. But auditors often get yelled at. Okay. They often get yelled at, just like coders. Coders get yelled at too. Billers get yelled at as well. But auditors have the extra oomph of people, because you're telling people that they're wrong, or you're having to correct people. So it really takes a very calm and even person to be able to do this. To be a very good auditor, you need to be a good educator. And to be a good educator, you have to be a very good communicator. If you don't have that, and trust me, I've seen it, where people love being an auditor, but they like being an auditor because they like telling people that they're wrong, or they like being the one to know everything. You have to be humble, and you have to be willing to say, well, you know what? The coder made a very good argument, and you know what? I was wrong. You live and you learn. As medical coders, medical auditors, medical coding auditors, you're never going to know everything. You're always going to learn something new. So if your goal is to be a auditor, then really look at it for the good position that it is, that you're going to be working and teaming up with the coders and to educate them on what you are seeing. And if they're showing you, if the coder is showing you that, well, there's this, okay, and then they're showing you everything that they need to show you, and they're able to pass along their knowledge for whatever training that they had or whatever they've seen or whatever they found out. And if you need to be able to be receptive for that. If you are looking to be an auditor, be receptive, because I've been audited before and I've come across very good auditors, and I've come across auditors that were very defensive if I was trying to show them how I had got the answer and how I got it and it was correct. And I'll usually show them the coding clinic that I used, or where it is in the book, or something else, a very valid resource, okay? You have to find those really valid resources like CMS, and you have to look in, books that are actually published, not these, like the Merck Manual, okay? Merck Manual is very good, by the way. Not like these regular old websites and he said, she said type websites. You don't want that. You want stuff that's firm and definitive. You want to be able to present your argument and present it with facts. It's going back to that aspiring attorney in me from when I was a kid, because I wanted to be an attorney when I was a kid. So it was always about proving myself and having my facts and bringing my receipts. So when you are a coder, so listen up, coders, if you want to be a coder, make sure that you are always bringing your receipts, okay? Show. And if the auditor is telling you that you're wrong and the auditor is explaining to you why you're wrong, don't keep arguing for the sake of arguing back because you don't want to be wrong. And it's the same thing for auditors. Do not keep arguing with the coder if the coder has proven their case, okay? You want to make sure that everything gets fair. Everything is fair. You want to make sure of that because you're going to learn and they're going to learn. And if you can sort of cut out that, okay, well, I always have to be right type deal, or I feel very defensive because I don't want to be wrong, you're going to be wrong. I've even been wrong, okay? I'm going to admit that. I'm strong enough to admit it. I don't like admitting it, of course. Who does, right? But when it comes to learning, that is what it is all about. My boss and I, we have how long have we been around each other? 8 years. We've been around each other 8 years now. And during this time, she has her instructor. She's CPCI, right? CPCI. And certified professional coder instructor. Okay, that's what she has. And of course, she has her CPC as well. And she started in the beginning, and she had been a supervisor before. And of course, she always brings her receipts, right? She's there with the book herself too. But I like to come in with not just the book, the CPT book or the diagnosis book, but I also like to come in with the Merck Manual. I'll come in with the coding clinic, and she likes to play with the coding clinics as well too. So that way she can have firmness for her argument as well. So we have a long relationship of going back and forth. And she even told me one time, she said, Blue, the thing I like about you is that you always bring your resources. You always bring backup. You never just say, well, I'm right because I'm right. and I tell her, I was like, well, I know I'm going up against you, so I know I need to be ready. And there's been times where we cannot agree because what she's saying sounds right and what I'm saying sounds right. So we do have to get somebody to break the tie, okay? And it's usually going to be another supervisor. One time it was the chief of the department. Just saying. But there's been times when she says, well, no, Blue, it's this. And she'll show me. And I'm like, oh, well, now I know. And she used to be like an x-ray tech. So she knows a lot about anatomy, which really does help. And it got her, because it got me technically a couple of times on an argument, because I thought, oh, no, it's this. And then she says, no, actually, when you look at it, and I said, oh, shoot. So she goes, so she's happy about it. So I was like, okay, you got that one. Okay, you won. But this is a really good relationship to have. You know, does it get passionate when we're presenting our arguments? Yes, it does. But at the same time, I'm respectful to her. She's respectful to me, even though we do get passionate. We do get where we're trying to show the other one, and it's not quite clicking yet. Because sometimes it'll take a second to click, and then you're like, ooh. And so she'll see me when I do that, like, now I know she got me, you know, because I didn't see it that way, or she didn't see it that way. And then we'll have that click moment, like, oh, okay. But to have a really good relationship like that, and to be able to do that when you are an auditor, and in this case, in my case, my auditor is my supervisor. So we do have an outside auditing company that takes care of some of the audits as well. So, but we do get internal audits. And so she takes care of that as a supervisor. That's one of her duties, on top of going to meetings and representing our department. Okay, she does that as well. They also run a lot of reports, looking for errors. If there's errors, if in transmission of the codes, sometimes that will happen. In electronic health records, sometimes information doesn't quite flow over because maybe there's an update or whatever the case may be. So sometimes we have to watch for these things. So it's her job to make sure that those things are really taken care of. But having that, being open to communicate, and her really kind of taking the time to show me, well, no, it's this. And then it's like, okay, that's a really good point to have. So if you are looking to be an auditor, be willing to know, or you should know, not be willing, but you should know that it does get where people are going to be offended because you're telling them that they're wrong. Now, I am at the point where I do not get offended if somebody tells me that I'm wrong. I'll have to look at it and see, well, did I do it wrong, or did I do it right, and I just need to show my argument. So there's always those things. So keep that in mind when you want to do auditing. But auditing is really great because you are teaching the next generation of medical coders, or you're teaching people who are going to take this knowledge that they've learned from you, auditing them, to their next place wherever they go, or they're going to take it to back to their facility, and they're going to be able to know more. Okay, it is about passing on that knowledge. There is so much to learn, guys. And as I've said, we as medical coders have to know what doctors know while never having gone to medical school. So it's a lot that we have to learn. And really being a high caliber medical coder, because I say this all the time as well, if you are a high caliber medical coder, you're going to go above and beyond and try to understand this stuff. And there's coders that are, oh, well, I'm here to collect a check and go home, so I'm just going to enter, and do whatever I need to do to get all of this stuff pushed through. Well, what happens when that happens is the patients can be affected because if the incorrect codes are being selected, who knows what they're being charged. Okay, that's number one. Number two, the facility is going to suffer, because if the facilities end up losing money, because if there's an audit and then you have to pay back because you either overpaid or there's a fine or whatever the case may be, that's another thing to look out for. And it's not helping you, number 3, as the coder to learn. You need to make sure that you're looking at everything and being very detailed and very conscientious about the codes that you are selecting, and being able to have that openness to communicate and taking it when somebody's telling you that you're wrong and they can show you why. So that's all a part of being an auditor. But an auditor is also going to be a really good person to keep that facility at a high level standard when it comes to accuracy. Because an auditor is going to care, or an auditor should care, about learning more every single time, so that that facility can be very accurate in their code selections and documentation, and always staying educated. Okay, so that's pretty much what an auditor. I could have done a whole show on what a medical coding auditor does, right? But going on to the leadership, okay? You have leads and you have supervisors, okay? Now, leads tend to be like, they're boots on the ground, and a lead is going to be right under a supervisor, okay? So that's usually how it goes, like coder, the billers and coders, like the leads, and then the supervisors, and then you have the HIM directors, okay? So with the leads, it is basically like a senior coder, right? That they have a lot of experience and they're just under the supervisor, but they're really sort of also helping to teach and guide the coders under them, right? And it's just sort of kind of having their back and being there to answer those questions, or making sure that things are clear, okay? So it's going to be somebody that's patient to be a lead, okay? And usually these people are also dealing directly with providers. They're in meetings and they just sort of take that second role as like a deputy to like the supervisor, okay? And whenever you're in positions like this, where you are in position of leadership, whether it is being a lead or being a supervisor, the thing about it is, I always recommend people that when they want to be leaders and things like that, that they take individual leader courses. And it doesn't matter if that is really kind of what your title is. I take leadership. I read the books and I take the classes wherever I can. Even though I'm not technically in a position of a leader, but I know I need these skills when I'm dealing with alpha personalities like these providers, when I am working with my supervisor and we are going at it about about the codes and everything in the code selections. And I know I need these skills. And in order to have these, I have to invest that little bit of time. So taking a leadership course, even though you may not be in a position of a leader, but just to take it is a really good thing. But if you are in a position of leadership, then you do need to take those. I would strongly recommend it, because very effective leaders can do so much for their people. Now, I've had a few supervisors, but I will say this. I'm not talking about my current supervisor. I'm talking about 2 supervisors that I've had before. Both were very excellent at being leaders. One was a former drill sergeant. Now, don't let this scare you, okay? I have been around service people my entire life, so service people do not scare me. But her demeanor alone, it scared a lot of people, okay? Because she's just very strong. She's a very strong woman. And to me, I thrive around strong women because I think it's good if they are doing it correctly, right? And what I mean by this is, she had this very strong aura about her that she was able to be a leader for her people, but at the same time, we all knew that she had our back, that she was going to defend us if we needed to be defended. And the second she heard any of her employees say that a provider yelled at them, she was Janie on the spot. And she would go to those providers and straighten out the whole situation. And then she would remind them, these are my people. If you have anything to say, then you come to me and I will take care of it. But you do not go to them. And I'm like, that's awesome. Because there was times when providers just, would get upset. And with her, that was not the case. I mean, they were not allowed. They were not allowed at all. And she made it clear that she wanted that decorum at all times. So that was such a great example of a really good leader. And she was the type of person that she would tell us, she would know everybody's situation. She knew how many kids you had, if you had kids at all. She knew about your family. She knew about you. She knew if there was anything off or amiss with her people, she could pick it up. I mean, she was very, very perceptive to everybody and what their needs were and things like that. So I think that's really great. And she made such strong strides to make sure that we were all educated. And she would ask us, well, what kind of education do you want? Or if you are bored in your clinic, then you need to reach out to me and tell me, I want to move on. I want to do something else. I want to learn something else. And you wanted to learn more because that's the kind of leader that she was. Because a good, strong leader will encourage their people to want to do more for that person. And it wasn't just about her. It was about bettering yourselves as coders. And that's what she taught us. So it was very difficult when she left. And I was very sad because she was very strong and she defended us and she did amazing. She really did. But, she moved on and to greener pastures. But, it was wonderful to have a good example of what a strong leader is. She was never one of those passive aggressive, never did that. And that is a sign of weakness. When I see that in a leader, that passive aggressiveness, you can't do that. You need to be direct. Or leaders that I don't want to be confrontational. No, there's times when you're going to have to be very firm and confrontational. And especially when you're working around a lot of women, that's another thing as well. We are dominated in this field by women. So you have to be strong in order to keep everything, no drama, right? You got to keep the drama to a minimum because drama can explode when you have leaders who do not exert that full leadership effect. Okay, so that is my my thoughts on that one. But I just want you guys to know that there are so many things. And then I'm going to wrap this up because I'm running out of time already. But the HIM directors are the ones that are manning the ship. They are the captain of the ship. They typically take care of the business side of the house. If they're running whole departments, they're taking care of the budgets. They're looking at all of the reports that are coming in, whether it's errors or maybe if there's, different statistics that they're pulling for like tobacco use or maybe heart disease or hypertension, things like that. They're looking at those things and they're talking with all the corporate people. So they typically don't do coding. Okay. I've been asked lately, like the RHIAs or the HIM directors, if they do a lot of coding. They typically don't because they are busy taking care of the business side of the house. And that's where they rely on their supervisors and leads to take care of all of that. So I'm going to go ahead and wrap this one up. But yes, that is a glimpse into the different positions, okay, that is in the health information management field or medical billing and coding. So I hope you enjoyed this. And thank you so much for tuning in. And I hope you'll consider supporting me on Patreon. I'll leave the link down in the description box below. I'm going to wrap this one up. If you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!